Okay, just have a quick look at our delegates. Okay, I think we shall make a start. Agreed, team behind? Are we good to start? We will make a start. So, welcome. Absolute pleasure to welcome you to the Team Talk online, focusing on a really exciting subject around decarbonising NHS travel and transport. I'm joined today by two Modeshift stars. See what I did there?
Nice.
Yeah, thank you.
Start.
Thank you. Good start to the webinar. Two Modeshift stars, obviously, Nick Butler and Tom Murray, who will be on this webinar with us. We've also got the rest of Team Modeshift in the room in the background, along with Sarah Fay over in the corner, who will be here to help you out. So what I'll do is I'll take you through the few housekeeping points, and then we'll go into the agenda, and then we're not going to hang around. We're going to get straight into it. So a couple of housekeeping. We will be recording this webinar and making it available for people after the fact. We'll also have the slides available after the fact. We also have a Q&A section, which is available in Teams under Q&A, and Sarah will be fielding the Q&A, and we will be opening various parts of this Team Talk so people can actually field some questions. So if you do have questions, please lodge the questions in the Q&A. If we don't have time to get to your questions, we will endeavour to do so, but obviously we want to keep this to time today. I've touched on, for those that arrived early, obviously if you could keep your microphones muted, that is appreciated, and also webcams off. And if you do have any issues or anything like that, please bear with us. We will endeavour to help you as we go. So without further ado, we will get the presentation on the screen there. So if we could share the presentation, please. Fantastic. I'm just going to remove this slide here. So I've been joined obviously by Nick and Tom, who are going to be taking us through the presentation. Bear with me, gents. Okay, off we go. Okay, if we could put the first slide on, please.
Perfect. I'll pick up from there then. So yeah, just as an introduction, most people on the call probably know. So Tom Murray, Modeshift Stars Program Manager for Business and Healthcare. So I'm just going to lay out the agenda. So I'm going to introduce a little bit of chat between myself, Nick, and Adam on that, just to get things rolling. And then we're excited that we're joined by Paul Chandler, NHS England Deputy Director for Net Zero Travel and Transport. We're going to set the scene with Paul. Just around kind of why this is so relevant for this sector, really linking into the NHS Net Zero Travel and Transport strategy that we launched in October of last year, and how we've linked that to the framework. And then really going into travel and transport in practice with some great speakers that we've got joining us online. So Gemma Andy and Dr. Joe Mayer are going to be joining us and really running through their experience of using STARS, but also practical travel and transport initiatives and campaigns and things that they've been running over time in their various different sites and trusts. As Adam alluded to, we are going to come to questions. It's quite a packed agenda, so we've got specific sections throughout to kind of come to those questions. If you can't get your question answered, absolutely put it in the chat or the Q&A, and we will try and come to you after this event. So don't feel like your question won't be picked up on, but we've got specific sections. We move across one slide, please. And then we're on to Modeshift Stars Healthcare launch. So something I've been working on about 20 months now, and a lot of you have been involved in that process of developing Modeshift Stars Healthcare and understanding how we're going to represent the sector and really deliver a framework that works for you and your travel and transport aims and objectives. So really excited that we're going to launch that today. So I'll talk you through some key themes and kind of areas that you'd want to understand. And again, we'll be much more on that beyond this call, but excited for that. Nick is going to take you through the fees and the membership, sort of guidance and areas for particularly those that have been involved with Step Up a Gear, perhaps. So from October onwards this year, we've got some key information on how we continue membership and continue all the benefits of using Modeshift Stars. Again, onto some questions, and then we're across to Sarah for some exciting and packed events that we've got planned coming up for the rest of the year and into next year at Modeshift. And then we should have a bit of time then to come back to the table and just summarise and make some key points about kind of any areas that you might want to be aware of that's going to happen in the next week or so as we move across to Modeshift Stars Healthcare from Modeshift Stars Business. So yeah, really packed agenda. So hopefully something for everyone to get their teeth into there.
Okay, over to the introduction section now. So if we could have the next slide, please. Over to you.
Hey,
Is it you? Is it still you?
Stole my slides. I was going to do a gender.
They were arguing before we actually turned the cameras on. They were having a bit of an argument, so I do apologise.
That's fine by me. Keep going.
Crack on, Tom.
Nick's just here for moral support. At some point he'll kick in.
I'll hold your hand.
I think probably everyone appreciates this has been my baby a little bit as Modeshift Stars Healthcare. So apologies if you get bored of my voice for this first 10 minutes. But I'd really like to kind of set the scene in terms of an introduction. So why have we been working with this sector? How has it been important for us at Modeshift and Modeshift Stars as a travel plan accreditation scheme to understand where healthcare is, where it wants to be, what their ambitions are, and how we can support it as the UK's largest travel and transport sort of sustainable organisation. We want to be part of this. We want to support you. We want to provide you with tools along your net zero journey. So yeah, just to really set us going with this webinar. So we recognised quite early that the NHS is the first national health system in the world to commit to decarbonise its operations. So a lot of talk around net zero across the various different sectors, but for us, healthcare is really important, and for us to understand and support that journey towards net zero by 2045 and the reduction in that carbon footprint has been something we've really built the framework and kind of the support we've done, whether it's at national conventions or bringing people together for best practice. So yeah, that's been at the forefront right from the start. I've said there over the last 18 months, we're sort of heading towards 20 months, to be honest. We've been working as a team here, a lot of people involved, but certainly as Modeshift, we've been working with NHS England, ICBs, up to and over 40 trusts across the country, as well as primary care settings and an awful lot more other people that I've not mentioned in there, to design, test and set a new accreditation scheme for healthcare. And we want that to recognise and reward sites for their efforts to increase the levels of sustainable and active travel. So we recognise that doesn't happen overnight, but right from the outset, that's what we wanted to achieve. We wanted the framework to not just recognise the work that you're doing, but allow you to kind of buy into evidence and experience and ideas to how you can create behaviour change and support sustainable and active travel. And that's culminated in today, really. So we're going to launch the Modeshift Stars Healthcare Framework today. That's the first of its kind in the country as a national travel plan accreditation framework that's sector specific for healthcare. So we're really excited about that, and we're excited about how much we work together with the likes of NHS England's net zero travel and transport team, and how important it is to have that partnership to make sure that this is as sector specific as it can be, to support everybody moving forward. So those are the three key things to kind of really highlight from the outset that we've been working on, and the ambitions really. So if we go to the next slide, please. Yeah, so obviously we've built everything around those 3 points and an understanding of those points, and a big part of that has been working with NHS England's net zero travel and transport team. So we're really delighted that Paul Chandler, Deputy Director of that team, has been able to join us on the call today, just to set the scene in terms of what the NHS England's ambitions are, targets are, and then kick us off with some real background on that. So we're going to pass on to Paul now.
Yeah, so Paul, if you're in the call, make yourself available, please.
I am. Hopefully you can see and hear me.
Okay, we can indeed. We're going to mute our microphones in the studio and we'll hand over to you.
Blended. Okay, thank you very much. I think I might need someone your end to move the slides on for me. I'm Paul Chandler. I lead a few transport teams in NHS England, including the Net Zero Travel and Transport team, which is a team that's been working most closely with Modeshift. I'll start by saying I'm a big fan of Modeshift personally. They've supported our Step Up a Gear network massively over the course of the last 18 months or so. Many of you are involved in that network, so thank you to you for your ongoing commitment as well. I'm even got the branded Modeshift mug, which you might not be able to see, but there we go. So thank you, Modeshift. They've been pivotal, I would say, in providing a recognised, standardised framework where Step Up Gear participants can start to document their sustainable travel plans, which is important. It's ahead of the curve. We published our net zero travel and transport strategy in October 2023, and based on the work that some of the Step Up Gear network participants have done, including but not limited to the work they've done on the Modeshift platform, we now require every trust and every integrated care board to develop a proper sustainable travel strategy as part of the Green Plan refresh process. We're actually aiming for people to have standalone sustainable travel strategies rather than them to fold it into an overarching green plan. And Modeshift provides, a platform. Others are available, I'm sure, but provides a really well-tested platform where you can start to build those sustainable travel strategies within an agreed framework, and to build that over time, and crucially, to receive accreditation for those sustainable travel plans as well, and also to join a community and a network of people who are all working to the same goal. From 2027, our strategy says that all new vehicles owned and leased by NHS organisations will be zero emission. That excludes emergency ambulances, which are a much more challenging proposition, but we see no real reason why for the fleet of vehicles that trusts own and operate themselves, they're generally cars and vans, they're generally 30 vehicles or fewer per trust, that we should be accelerating that transition to zero emission vehicles wherever possible. So that is a milestone within our strategy too. And then by 2033, this is more of an ambition, I would say, than a hard and fast target, and it will be measured nationally rather than by each individual NHS organisation. But over the next 10 years, we're aiming to halve the carbon and air pollution emissions from staff commuting, by encouraging active travel, by encouraging public transport. But if we're honest with ourselves, also seeing quite a mass shift of people travelling from petrol and diesel cars into electric. We are, realistic that will form quite a large part of that overall halving of travel emissions. Next slide, please. Thank you very much. So, travel and transport is key to the NHS's overall ambitions to reduce its carbon emissions, and the NHS's efforts to do that will be key to the UK's aim to reach net zero by 2050. You'll all know that the NHS is the largest employer in Europe. It's also usually the largest single employer in any kind of town or small city. Is typically the largest employer, and it's also usually one of, if not the biggest trip attractor, given how many staff, patients and visitors access NHS healthcare facilities, whether that's hospital, primary care or something else, every day. So it's a really key feature of modal shifts. And whilst we focus on staff commuting up to now, the approaches that NHS organisations have used to tackle staff commuting emissions will be largely applicable to patient and visitor travel as well. The NHS has the second largest fleet in the UK, second only to the Royal Mail. But having said that, our fleet emissions, the NHS fleet emissions, is quite a small proportion of our overall travel and transport emissions. Around 5% of our total travel and transport emissions in the NHS come from the vehicles we own and operate. Far over half of those travel emissions come from the way that staff, patients and visitors choose to travel to NHS facilities. So there's a big prize there in terms of changing travel behaviours and encouraging sustainable travel in NHS staff, patients and visitors. And that's really what the Step Up Gear programme has been set up to achieve, in partnership with around 50 trusts and ICBs across the country, and with Modeshift as a real key partner in that. And we're delighted that Modeshift have taken the decision to develop a health-specific Modeshift platform. For now, we've been using the platforms that have been set up for schools and local authorities and businesses, and having a healthcare-specific one, I think, is a really important next step along the journey that we're all aiming for, which is to decarbonise NHS travel and transport, decarbonise and reduce air pollution emissions as quickly as is reasonably possible to do. Last slide, I think, please. All right, I think that's me done, but happy to field any questions that anyone might have before we move on to the next part of the session.
Some questions, is that right, Sarah?
We do. I am the question queen. We have two questions. The first question is from Dan Caulfield. He has said, question for Paul around by 2026 sustainable travel in trust and ICB green plans. He said, I would anticipate there being an increase in aligned plans and then single system-wide green plans instead of multiple plans in each ICS. Do NHSE have any aspirations along these lines? I hope you got that question.
Yes, so I mean, green plans will cover a number of bases, not just travel and transport, estate, medicine, supply chain, food and nutrition, lots of different areas. In some of those areas, it makes sense for you to consider what actions you might do at a trust or even an individual site level. And for other parts of emissions, it might make more sense to have a more coordinated ICB plan. I suspect travel will be a combination of those things, individual initiatives at each individual trust, depending on how staff at individual sites travel to work and how they'd like to travel to work in future, and maybe some more overarching transport infrastructure plans that might work better at an ICB. So I think it will be a bit of a mixed economy overall. Of course, sustainable travel plan or strategy will mean different things to different people. So we will be publishing, my team will be publishing towards the end of the summer, maybe autumn, a guide about what we actually mean by a sustainable travel plan, a process we'd recommend for trusts and ICBs to follow to get to one, and some examples of some really good ones, including some good ones that exist within the NHS so far. But then, yes, I think, you know, trusts will have a sustainable travel plan and ICBs will have a travel plan as well that might not simply be an amalgamation of all the trust travel plans. There might be some other overarching things that an ICB might want to put in their plan as well, or instead of. Hopefully that makes sense.
Thank you. I do have another question as well from Dave Darnell. He says, any strategies for encouraging patient/visitors to hospitals, healthcare facilities to travel more sustainably? It's quite a large question, but
I mean, it's a good question. At the moment, the NHS don't routinely collect any information about how patients and visitors travel. We do collect some information on staff commuting. It could be better, it could be more widespread, but at least we've got, you know, some trusts that have got a very good idea of how their staff commuting, and an increasing number of trusts that are doing that work. No one really surveys patients on their travel at the moment. We are about to launch a national NHS patient travel survey with a company called to be determined. So we're going to start to fill in the gaps, but for now, for the next year or two, we think people will be focusing mainly on the staff commuting. That's okay. And as we build up our understanding of patient and visitor travel, we might broaden those sustainable travel plans out. So the next version of a sustainable travel plan might be due in another 3 or 4 years' time. And at that point, we might have a much better understanding of patient and visitor travel, and therefore a much better understanding of the actions we might take, as you say, to encourage and support patients and visitors to choose more sustainable travel options.
Thanks, Paul. I just, Nick from Modeshift, I'm just wanting to add a little bit to what you've said there as well, in that it's good to hear that patient travel will be coming along down the line as well. But just to highlight, when Tom's talking about the STARS Healthcare Accreditation Scheme, that very much includes initiatives and activities around encouraging sustainable active travel for patients and visitors as well. So those trusts, those sites that do promote active travel can be recognised for that. And of course, staff travel's a huge part of that as well. But the STARS Healthcare Scheme is encapsulating all trips to those sites. So hopefully we'll cover a little bit of that.
Got more questions? We've got time for more questions? Perfecto. This one is probably for Paul and a little bit for Nick and Tom as well. Which trusts were involved in setting up the Modeshift healthcare scheme? That's quite a question. Do you remember, Tom?
There are 30 of them.
I'm not going to pick out all 30 and name them, but I can say there was
Oh, go on.
30 NHS trusts, which were a fair spread around the country. So we had pockets around the country, and it's probably fair to say that we're in areas that did work regionally. So it's worked really well from Modeshift point of view to gather that experience of using Modeshift Star's business as it was the existing scheme and feedback regionally in focus group meetings and in kind of local authority led meetings as well. So kind of leading towards Manchester particularly was very strong in working with us, Southwest as well. So yeah, not wanting to pick out individual trusts. So yeah, up to 30, which dipped down to 28. Then we had York as well come and join us, which was great. So yeah, 30 specific trusts who step up a gear. We also had, just to call them out, and I think some of them are on the call, some NHS trusts that weren't involved with Step Up a Gear, but have been involved with Modeshift as corporate members and have been on their own journey, achieving some really great things. So, I mean, they've been really good in kind of teaching us how they work in partnership with local authority and providers in their areas. And that's something that we've been able to pass on to the Step Up a Gear participants as well. So, yeah, although we mentioned Step Up a Gear a lot in this call, and that's been great for us to collect that base of knowledge to then go on to produce the framework. Yeah, just not forgetting the existing trusts that are involved directly through Modeshift as well. So I've copped out of the question of naming specific trusts because really it wouldn't be fair. We've had sort of, up to 35, 36 trusts throughout the last 2 years working with us.
Paul, did you have something to come back on there?
Just to say, the Step Up a Gear network, of which the membership is then drawn to support, Modeshift was set up to cover every part of the country. Every region had some Step Up a Gear provided, and a real range of size and types of trusts. So some small community trusts, some mental health trusts, some really large multi-site, acute, some rural, some coastal, designed to have a really good mix of different types of trusts. And I think that will be reflected in the design of the Modeshift for healthcare platform.
We've got loads of amazing questions coming through. I'm not sure which one to pick. So we've got questions about parking charges. Staff parking charges are an obvious but uncomfortable subject. Any change in policy on that? That's a big one.
Political.
Again, these are big questions.
Not for us really. For the DHSC, we are agnostic whether you charge your staff for car parking, but we do recommend that car parking is allocated to staff on a agreed policy with some criteria about which staff get car parking permits and which ones don't. The problem with not charging patients for parking is that they then members of the public then park in your hospital car park and go and do their shopping elsewhere. We've seen that in lots of trusts. So we do think there probably should be some charges for patient car parking, even if they're nominal, to avoid that kind of behaviour. But yeah, a national policy on what should be charged for car parking is very distant and is politically fraught. So we tend to just advise trusts who might want some advice about how they might allocate car parking permits to the staff who need them, and that's about where our remit started and ends for now. But totally agree with you, car parking control and allocation is a massive potential driver of modal shift.
Right. Cool. Thanks, Paul. You're now off the hook. Thank you for your time. I think there's tons more questions coming in. We might send those over if there's some specifics that we can't answer. We're going to do a few more Q&A sessions throughout today as well. And we will try and pick up and answer as many as we can. But as I say, we'll jump on the chat and reply to them if we don't get to actually do them live as well. But thanks, Paul. We really appreciate your time. I know there's a lot going on at NHS England at the moment, so very much appreciated. We're going to head into our next session now. So Paul's given us a great introduction to the NHS Net Zero Travel and Transport strategies and why this is so important. We're going to move into a session now on how that's actually being put into practice, starting off from a foundation trust level, then we'll be rolling into a hospital setting and finally a GP setting as well. So first up, we have Gemma Heath from Salisbury NHS Foundation Trust. Gemma, I can see you coming on screen.
Yeah. Hello. Can you hear me?
To deliver your slides.
Yeah. Can you hear me okay? Okay, fantastic. Okay, so hi. Sorry, there's a bit of a delay there. I'm Gemma Heath. I'm the Sustainability Manager here at Salisbury NHS Foundation Trust. And I'm going to share with you today some of our travel and transport initiatives and our general approach to gaining Modeshift Stars good travel plan status. Our Modeshift Stars journey started at the beginning of 2023, and we achieved bronze accreditation in August of that year. We had some support for sustainable travel in place when we joined the programme, but we have since improved our facilities, our support and our engagement with sustainable travel considerably over the last 18 months, hence the gold, that was a wishful thinking, hence the bronze accreditation. So I thought I'd start with a bit of background. I've been in post for almost 2 years, and it's my responsibility for embedding our green plan and helping our hospital to reach its net zero target. And for a bit of scale, Salisbury Hospital is an acute hospital, and we provide care to approximately 270,000 people in Wiltshire, Dorset and Hampshire, with somewhere in the region of 4,800 staff. Location-wise, as you can see on the photo on screen, we're on one site. We're based on a hill, approximately 3.5 kilometres south of Salisbury city centre, and our estate itself covers some 21 hectares. In terms of the sustainability team, well, it's myself and Lucy Davey, Sustainability Officer, who focuses specifically on travel and transport, and in fact is the person responsible for submitting and ensuring that we met the criteria for the bronze accreditation. So when I was preparing this presentation, it was really hard to condense my thoughts on what we do into just 3 slides. So I kind of had to take a step back and look at my sort of poorly hand scribbled notes. And I realized it was probably easiest to explain if I divided what we do and our initiatives into 3 categories. There's a little bit of overlap between them, but essentially the categories are engagement, facilities and support, and events. Next slide, please. Thank you. So engagement. So I am a huge believer that engagement is absolutely crucial with stakeholders and is key to decarbonisation of NHS travel and transport, because our individual daily habits are often dependent on the transport that is available to us. We can't just complete surveys, I don't believe, without listening to those surveys and doing something with those results. Otherwise, in my opinion, they're of no use. We can't create sustainable change only by adhering to regulation and guidance. To decarbonise, we are going to need to make difficult decisions, and we need to shift attitudes and behaviours. And I believe we can only really do this if we know what our stakeholders need, if we furnish them with information and the tools for change, and if we have their trust and their support. And then I think they will come with us on this decarbonisation journey. So in terms of engagement at SFT, so we've conducted a staff travel survey in 2023. This provided us with helpful insight into the number of car, bike and bus commutes, including frequency and distance travelled as well. It also gave us an idea of the effectiveness of our own comms for raising awareness of draft discounts and facilities and wellbeing benefits. And it gave us some reasons why staff felt that mode shift and behaviour change was either not something they felt able to do, or in some cases would even consider. At various times throughout the year, we have left random act of kindness notes or golden ticket drinks vouchers on bike handlebars that are sort of dotted around site. We've also established a loyalty scheme for lift share users, so those who share their journey to work and record their number of trips, clock up stamps and then get something like a free drink in the restaurant. We helped set up a bike user group called Bug, where our cycle commuters share a voluntary WhatsApp group and can post updates on commute routes. So if they're cycling to work and they come across a flooded underpass, which happened recently, unfortunately, or a low-hanging, very annoying branch that clips you on your way past, they can post it in the WhatsApp group and let each other know. This has really encouraged them to support each other and gives them a sort of sense of community, and that they don't feel like they're sort of out there cycling on their own. We have a monthly sustainability newsletter, which includes a travel section where we share information, events and staff stories, and available to all staff, but now handed out to every new starter at the hospital in their induction pack, is our very own sustainable commuting leaflet. This details all sustainable travel options and any access to the associated benefits and discounts. And I think probably our best example of really successful engagement was actually the creation of our public transport user group, which we refer to as PTUG, through which our bus users meet with us every quarter so we can gather their constructive feedback and new ideas from a representative cross-section of staff who are public transport users themselves, primarily bus users. And they get to talk to us about the range of services that are operated, the prices that are being charged, the infrastructure, and the effectiveness with which those services are provided on a day-to-day basis. So we get sort of real-time feedback. And we're joined at each meeting by a representative from the bus company. And this has really provided a really effective channel of communication from the bus company to the users. And it has given the bus company an opportunity to explain. So when things have been going wrong and everyone's moaning, they've actually had the opportunity to say, well, this is why this happened, or this is what we plan to do about it. And the constraints that they may have, because not everything is their fault. We've had some road closures around the city, which has obviously impacted the service. So we've really built a mutually supportive relationship through this group. And even better, it's actually resulted, I think, in real change. So we have actually been able to, or the bus company has been able to provide extra morning buses and an additional afternoon peak bus as well. And has in fact influenced the extension of a bus route to the edge of Salisbury that hadn't previously been serviced. So we're supporting, we're improving the bus service for our staff on their commute, but also for our patients as well. Next slide, please. Facilities and support, my second category. So again, I believe that if we want people to make sustainable change to the way in which they travel, then we have to provide the sufficient facilities and the infrastructure and the support and incentives. We can't keep telling people what they must or should do. I really don't like doing that. I think we need to make other modes of travel accessible and available. And then I think that the reasons not to switch will become unarguable. So to support our bronze status, the facilities that we offer are a 40% bus discount with the local bus company. So that's 10% funded from the bus company and 30% funded by the trust. We have a cycle to work scheme for salary sacrifice. We also have a salary sacrifice for car leasing, but we've capped this at hybrid and electric cars only. We have dedicated lift share bays for those that share their commute to work. We've got EV charging, so we've got 14 chargers which sit on the BP Pulse network. These are available to both staff and visitors. And we've got one electric van for our States team, and we're about to have an electric van for our town courier run as well. We have e-bike charging facility on site. So if a staff member gets to work, needs to top up their battery to get home, then they can plug it in and do that safely. We have secure cycle hubs, which are accessed by a staff ID badge only. These have locker facilities, and we also have very simple sort of addition, which was a bike lock bar. So you can see on the screen there, we've got a little sign up saying, don't lug your lock, leave it at the lock bar. So it's for staff who don't want to carry a necessary, but quite often heavy lock back and forth with them every day. We provide free access to lockers, some within the bike hubs, as I've said, but also others within our staff fitness club on site. And it also provides access and shower changing facilities for them as well. We own 5 e-bikes, which we loan out to staff for their commute and their domestic pleasure. This particularly works well to combat the fact we're positioned on a hill, and the excuse we always get, oh, the hill's too high, too much for me, I can't handle that. So when we say, well, how about trying an e-bike? And they then find that they quite often just glide very gently up the hill. And a lot of people have actually gone on to purchase an e-bike through our Cycle to Work scheme. Our fitness centre offers free static bike training. So again, we assume that everyone can immediately get on a bike and be happy and comfortable riding. That isn't always the case. Some people want to get their fitness up a bit. So we've got a free scheme running with them. We've put all of our information, our support and our links, which are available at the touch of a button on our hospital intranet for staff, and it's also on our trust website as well for patients. And a really small service, but particularly well received this year, given the awful weather that we've been experiencing. We introduced an umbrella loan scheme for those who walk to work and find themselves without any cover should the heavens open on their return trip. Completely free of charge. We just ask that they simply return the umbrella the following day. Next slide, please. Okay, and finally, events. So we hold regular events throughout the year to engage and provide practical support and promote sustainable travel, both in terms of the options and also the benefits to people and planet. We hold regular doctor bike service days for staff bikes, and we also allow them to bring in their children's bikes as well, should they wish to, because we think that this supports staff to encourage a sort of sustainable travel culture at home as well. The local neighbourhood policing team have been on site with us a few times to offer free bike marking. We offer staff education for sustainable travel. So we recently held a puncture repair masterclass where one of our staff members, he's actually our health and safety manager, so it's quite apt, and he's a cycling enthusiast. He actually performed a live sort of puncture repair demo, which was really interesting and surprising that quite a lot of staff who cycle actually have no idea how to repair a puncture should they get one on their way to work. We often pick a day or use national events to sort of piggyback off and encourage a day to cycle to work. We held a Travel Green to the Green Day, where we asked staff to leave their car at home and come on foot, bus or bike to work. And it was called Travel Green to the Green because we have an area on site that is known as the Green. So they came there and they had their picture taken and were entered into a prize draw. We hold regular days as a team in our main hospital restaurant with a stand, banner and information on all travel. And we've also sought support from one of our cardiac consultants, who is a cyclist herself. And we've got a sort of statement of endorsement from her about the health benefits of cycling, which we promoted alongside the Healthy Hearts campaign. And inspired by the Modeshift name, we held our very own Modeshift May campaign to encourage single occupancy staff drivers to switch their mode. You can see in the middle of the screen there one of the large format signs that we had. And we had one of these positioned directly opposite the staff car park exit. So as they were driving out each day, they really couldn't miss it. And we hope sort of made them think about would they travel differently the following day. Each week we focused on a different mode of travel to share the information, staff case studies, stories and pictures. And we also did some random act of kindness thank yous as well to those that were already sort of travelling sustainably. So Lucy even hopped on the bus at one of the hospital stops and sort of travelled around the site a couple of times each day during bus week so that she could offer a thank you chocolate to everyone getting on and off the bus, which went down a treat. And we also included working from home in this campaign to encourage staff not to travel where they can. And it helped us to sort of share and make staff aware of the Trust's flexible working policy, because after all, the most sustainable commute is the one that doesn't happen at all. So I think that summarises how we have achieved bronze accreditation. We'll continue to do all of these initiatives and look to improve and add where we can, and ask for feedback and ideas, because as I say, crucially, I think we need to listen to our staff and to our patients. And then encourage everyone to think about their individual actions and the footprint that they're leaving behind. Thank you. I think that's it.
Perfect. Thanks, Gemma. Yeah, a wealth of ideas and initiatives and campaigns run there. So I can see a lot of questions coming in. We're going to go through the next two presentations and collect all the questions together. So we will come to the questions. But yeah, if we can put those on hold for now, and then thanks, Gemma, for that great presentation. We're going to go straight across to Andy Johnston from East Riding Council, who's going to give us an insight now into kind of working with Castle Hill Hospital across in Hull, and a little bit of a different perspective in terms of a partnership between a local authority and that Castle Hill Hospital. So yeah, going across to you, Andy, and thanks again, Gemma.
Yeah, thanks, Tom. Thanks, Gemma. Hope everybody can hear me okay. Everybody hear me? Perfect. Okay, first slide, please. So, as Tom mentioned in the introduction, I work for East Riding of Yorkshire Council in their sustainable travel team, and this is a kind of summary of the last 3 years of our engagement work with the local authority, with the local hospital, which is Castle Hill Hospital, but it's part of the Hull University Teaching Hospitals Trust. So that involves Castle Hill and Hull Royal Hospital. This is a great picture here of a lunchtime walks. This is a weekly walk for staff, getting out of the office, having 15-20 minutes in the fresh air. So it's a great example of one of the many initiatives that the team at Castle Hill deliver. Next slide, please. So before we started our work with the trust, we kind of sat down with the team there to try and understand what were the opportunities, what were we trying to do, how could we work together to achieve some sort of modal shift. And like most hospitals, they face the challenge of everyone wants to come in a car to work, all their staff want to commute in cars, and the car park just isn't really big enough to accommodate everybody who wants to travel by car. So before we'd even started the work, as part of their 030 campaign, they'd done some work with their HR department just to see where people actually lived. And when I first saw this, I thought, oh, this is kind of such a powerful tool to have. And it's so simple to just take the first 4 digits of postcodes of staff and just plot them together. And you can see how, you know, there's probably 80% of the people are clustered together. And you look at this and you think, well, that grey cluster isn't far from the workplace, from Castle Hill. The pink cluster isn't far from Hull. Surely there's a bus service that will be able to take all those people. If you've got, for example, over 400 people at a HU5 postcode, how can we get those people to the workplace in a more sustainable way? So for me, this not only shows obviously where staff live and where the kind of top locations are for staff locations, it demonstrated to me that the trust already is kind of up for finding out where we are and also what are the opportunities. So it was a really positive first meeting. Next slide, please. So the current status for Hull University Teaching Hospitals is a very good travel plan. And as previously said by Gemma, she went through a lot of initiatives and great initiatives that they've done. And they're very similar initiatives that have been delivered at Castle Hill to get to the good status. The very good requires some modal shift and requires some significant participation in the travel surveys. So there's 5,000 staff at the Castle Hill site, and there's around the similar amount at Hull Royal. Many of the staff will spend half the week at one workplace and half the week at the other, so they do move between sites. And not untypically, in 2022-21, the 64% of staff were driving to work, 11% were using the bus, and 3.6% were walking. And after some significant work and projects and pilots, that the current figures show a significant shift away from driving, a massive increase in the bus uptake, and also an increase in the number of people walking. So it's not an insignificant shift, and this is mainly down to the team that I worked with and the relationships that the team has with the local bus companies, the ability to look at those postcodes, clusters, say to the bus company, look, we've got significant numbers of staff living in this location. Can we put an additional stop? Can we put an extra stop to try and get some of these staff to get on the bus? And with everything that we do when we're engaging with staff at Castle Hill, we always say, try it once a week, twice a week. We're not asking you to sell your car or leave your car at home every day. What we're asking for is give it a try. And I think that's the way the behaviour change has to go. It has to be really mainly carrot. There aren't any cycling figures on there, but the cycling figures are very close to the walking figures. So there's a slight uplift in the number of cyclists that we have managed to encourage over the last 3 years. So for the success and to get to very good, we kind of looked at the data we had, looked at the resources we've got, and then we put some measures in place. And then everything that we're doing, we deliver, and then we review it. And a lot of the bus success has been around fantastic work the team have done there, is to pilot a scheme for 6 to 8 weeks, to promote the scheme heavily to staff, tell the staff this is a pilot scheme, it will operate for a limited period. If it's supported, it'll stay in place. If it isn't supported, then you may not be there. Next slide, please. So to achieve significant behaviour change and the successes that we've achieved at the Hull University teaching hospitals, it requires a team of people. And if you're going to pick a team in a trust and to achieve success, these are the people that you need on your team. So you need the wellbeing lead, the communications manager or communications team, transport manager, somebody from estates, ideally the estates manager, and somebody from the sustainability team. And at Hull Royal, at Huff, we've got all those managers as part of the team pushing to make this work and delivering the activities and the initiatives. Also sitting down and reviewing the successes, maybe the failures, the adaptations that need to be made to the next round of initiatives to make them a success. Next slide, please. Oh, that's it.
Thanks up.
Cool.
Yeah.
Thanks, Andy.
Yeah.
Oh, sorry, getting some feedback in here. It's off. The sound's off. Some amazing results been achieved at Castle Hill, and I think we'll come back to questions shortly. But one of the things, Andy, I'd like you to share in questions is also the response rate for that survey as well, because we often hear from healthcare settings that getting really good responses on staff travel services is difficult. But I know you guys have done some brilliant things over in the East Riding and in Hull as well. We're moving on to our final presentation in this section. We've got Dr. Joe from Foundry Primary Care Network. Really important to think about primary care when we're looking at sustainable and active travel for healthcare settings as well. Tom and I were looking at some statistics earlier. I think it's around 30 million trips per month of 30 million GP appointments per month in primary care settings, which presents a huge opportunity to change or encourage more sustainable and active travel journeys. And Jo and her team across South Yorkshire have been doing some brilliant work. So looking forward to hearing from Jo if you want to unmute and take us away.
Hello there, can you hear me okay now? All good, thank you. Thank you very much, and thank you to those previous two speakers. So yes, my name's Dr. Jo Marr. I'm a GP in Sheffield, in North Sheffield, at Winkerbank Medical Centre, which is part of Foundry Primary Care Network. And I'm going to talk to you about the project that we've done in that network. Just getting the beginning, these are our first steps. So it's great to hear the progress that the Foundation Trusts and the hospital trusts have been able to make, but in line with the sort of scale that we work with, we're hoping these are early stages that we're going to be able to feed into the ICB plans, and in the words of my colleague at the Mayoral Combined Authority, where I also have a role, that we industrialise what we've done with this small project. So like I say, I'm a GP at Winkerbank Medical Centre, but I also hold a role with the South Yorkshire Mayoral Combined Authority, acting Active Travel Commissioner, Ed Clancy, and his team, where I've been the lead health advocate over the past year. So I strongly believe in the importance of walking and wheeling for all, and in that advocacy I've been able to work alongside Modeshift, specifically looking at what happens within our network for the people that are employed in our network. So in conjunction to put, sorry, I'm just seeing a name that I recognise in the box there. It's a bit off-putting when you see people joining. It's very nice though. Okay, so Foundry Primary Care Network is 8 practices working across 10 sites in the north of Sheffield, and we have a strong focus on both sustainability and the social determinants of health. I hear what Gemma was saying earlier down in Salisbury. We also have similar challenges with geography in Sheffield. You can see in the picture in the background the huge hills behind the drawings of my premises, but also some other local Sheffield landmarks. So Sheffield has 78 GP surgeries, and we work across 13 primary care networks under the South Yorkshire Integrated Care Board. Okay, so across the whole of the Integrated Care Board, there's actually 170 GP practices. So with this early work, we're hoping we can feed into the ICB green plan and, like I say, scale up, industrialise the work that we're doing. Another driver for us and for me with my physical activity advocacy is we know that 1/3 of adults do not reach the CMO, Chief Medical Officer's recommended physical activity target of 150 minutes per week of moderate activity. So thinking about our staff well-being, as well as thinking about air quality, as a physical activity is incredibly important. Our staff are our most valuable asset. If we're to deliver the number of appointments we need to at these sites, we need to look after our staff. And I think active travel, helping to walk and wheel, is a very important part of this. So that's why I was really keen to, when I got the opportunity to work with Modeshift, to look at how we use the toolkit to support our staff. Now, I've heard about the wonderful wellbeing teams and sustainability teams that colleagues in trust settings have. Unfortunately, with economies of scale like that, we can't compete. I have a network manager, fantastic, very supportive network manager, but it is just one person. Thank you very much. There's my picture. All right. Okay. So we have to think about how we can beg, borrow and steal time from where we can to do projects like this. So I was very happy when the University of Sheffield lent me some medical students. Well, I say lent me, these are students that have volunteered to do sustainability projects as part of their degree course. So it's an opportunity for them to learn about primary care teams and about the needs of those teams. There's 2 of my lovely students there in that picture. That's Nelson and Hafsa. We went on a walking tutorial and I talked to them about the value of the green spaces that we have in the city. You can see some of my staff team there meeting with a local counsellor for one of our doctor bike sessions. You can see a rather impromptu bike shed that was created at Page Hall Medical Centre, and the more formal one that we have at my own practice with Keeley, one of my reception staff there. So just to bring to life some of the people that are working in this setting. These are the people that we're working with at this time. So I had the students for 6 weeks, and with the support from Tom from Modeshift, we were able to use that time to do the initial accreditation steps for our sites. Now, this includes quite a lot of detail about those practice sites. So I think it was really beneficial for the students to learn about the challenges within the local area for accessing those sites. And that was an essential part of the project for them. But as a network, it helped us to get this baseline data. Okay, so these greener practice placements are very well established. It's not just a Sheffield thing. So for people listening across the country, I'd encourage you to have a look at another toolkit, a good toolkit as well. It's the Greener Impact for Health toolkit that's used. I think me and Tom looked it up, and we actually found there's hundreds of sites across the country that are using this toolkit for their student sustainability placements. So there's a lot of enthusiasm within primary care to look at how we can improve sustainable journeys. We know that 4% of the NHS footprint is made up by the staff commute, and we're really keen to see how we can reduce that footprint. But obviously it has to be in a different way to the larger hospital trusts. So do you want to move on to the next slide, please? That's lovely. Thank you. So that's just some of the details there. I think I've talked through that. So I tell you what, should we go on to the final slide? Thank you. Okay, so this is just to show the wonderful Modeshift team and some of the people we've been working with at the Modeshift conference that I was lucky to be able to attend back in November. So what have we learned as a network from this project? Well, we're just, like I say, this is early stages. So we're just starting to get to grips with the needs of the staff within our network. And we're just now creating our first travel surveys for the entire network. So we have some enthusiasts, like I say, at certain sites, at 1 or 2 practices that have already got well-established travel surveys, but we really want to make sure we capture the entire network and create something that we, like I say, we can then use to feed into the ICB Green Plan. Kavitha's there from the ICB team in that photo, and she's there with a clinical sustainability fellow in the background, Andy West, who's also doing work at Doncaster. So we're keen to learn from each other and learn ways that we can use what we've established with Modeshift to work this at scale. We've learnt about the benefits of collaborative working. Like I said, we've worked with Sheffield University medical students, but we've also been fortunate to feed into the Sheffield City Council Better Points scheme. So with our travel survey, we'll be offering Better Points vouchers for completion of the survey. So we've got a little incentive there. As I've said, we've already done some initiatives, but I think we need to capture what the needs of the workforce are first. So we can tailor and provide some behavioural insights into what the team actually wants, what will be valuable. So we're optimistic for these early stages and developing it further as this project continues. Another thing we've been able to do is use some time from another clinician at another site. For the first time, we've appointed a sustainability lead for the network, Dr. Emma Castle, who's very enthusiastic and will have the post for the next 2 years. So we're optimistic that that will be something that can be more established, looking at how we can do this across different sites in the future.
Sarah.
Perfect. Thank you very much, Joe. That was brilliant. We've got loads of questions come through. I'm going to run through them in probably order of presenters, I think might be the easiest way of doing it. So Gemma, you're in the hot seat. Are you still there? You've not run away?
I am. Yes, I'm here.
Fab. We've had really, really good positive comments actually, Gemma, about your presentation. Some of them saying how they love the sustainable commuting leaflet for new staff, and it's a great initiative to set travel behaviours from a colleague's first day, which is always really good. We've had somebody else saying this is so good, capital letters S and O. So this is so good. So they really enjoyed listening to what you had to say there, Gemma. We've got a couple of questions that are all categorised into the same group. So we've got funding questions. Mm-hmm. How much does it cost each year to deliver what you're delivering is a big question.
So the one I saw was about the bus discount specifically. That costs us, well, we've got allocated £60,000 a year to subsidise that as the 30% subsidy. So we're spending about, it fluctuates a little bit per month, obviously, depending on the tickets sold, but we're spending sort of anywhere between sort of £5,500 to £7,000 a month on that subsidy. Funding is something that I always get asked, because I'm quite fortunate. So I sit within the facilities team here at the hospital. So I think possibly compared to some teams, I have a little bit more access perhaps to revenue spending and things like that. So we don't spend an awful lot. I actually try to get as much done by other people as I possibly can. So sometimes I'll be a bit cheeky. So with the sustainable commuting leaflet, for example, didn't cost me a penny, asked our comms team here if they would help create something, because I wanted it to be on brand with the hospital and everything, obviously, and kind of by going to them and saying, you know, what do I need to do to make it on brand, they took that on as a project, and they had some funds that they were able to allocate to that. It also fell slightly within our sort of workforce and system leadership area of the Green Plan as well, being for the induction pack. So I kind of try and find money where I can, by sort of approaching different teams and kind of, you know, getting to know them and buying them I don't know, bar of dairy milk or something. And but yeah, so yeah, that was the one question. What was the other question? I'm sorry.
I think you've covered both of them, to be fair,
okay,
in that one.
good.
We do have a question about e-bikes.
Yes.
There's been quite a bit of a conversation about e-bikes and how you charge them, and the different charge connectors and safety concerns and all that kind of stuff.
Yeah, so again, I think I've been really fortunate, to be honest, with the fire officer that we have here. He had our local fire service in, and they reviewed the areas that we suggested putting them. They agreed to 2 areas, so they had to be a certain distance away from a building in order to be safe. And then in terms of the actual sort of connections themselves, what we've done is we've written it into an existing policy. So we have put that they must always use a manufacturer approved charger and battery, and if they spot any signs of wear and tear or damage, etc., and then if they replace their charger or battery, then they need to buy an official you know, manufacturer approved one from a reputable seller. So we've kind of got it in the policy, and I think what has happened is our fire officer has accepted the level of risk in terms of that. And so I've had a few trusts sort of contact me and say, how have you got this through? Because our fire officer just says no. Again, it was just about communicating with them, telling them why we need to do it, the benefits of it, agreeing with them where we could put them so that we met their criteria, and really sort of coming to a sort of a middle, you know, a sort of a happy medium, really, I guess.
Thank you. One final question, actually, which is more with regards to STARS accreditation.
Yes.
There's one comment saying, how are you only bronze? How are you only bronze level?
Well, ask
and you
Tom.
should surely be you know, right up there. So I'm assuming that you're working through the stages with Modeshift and with Tom.
Yeah, we are definitely. So we're a very small team, as I said at the beginning, and we're very new. So we've kind of joined the platform. We've managed to achieve bronze with things that we had and the things that we have introduced as a team. But I think really where we're lacking is probably our data, our baseline. I know someone in the chat asked that, you know, can you provide us with your baseline data? Honest answer is probably not. So we've done the survey. We know where we've got to improve, areas we need to improve on. And we have started over the last 12 months to actually kind of try and baseline some of that data in that modal shift and capture that. It's really hard to do because there are so many variables as well. But I think that's something that we're trying to improve, and I think we need to improve in order to achieve that silver level, really, of accreditation. So I think initiative-wise, I've shown quite a lot. We're probably, you know, quite good capacity on what we offer our staff, but so I think that hopefully will be an easy tick, but we'll ask Tom. But I think the next bits are actually about providing that data, that sort of robust data on the impact that we've had.
Yeah, I was going to jump in on that one as well. Thanks, Gemma. Yeah, no, just to emphasise really that the accreditation is there. It's nice to move through that accreditation at pace, but I think it's also about using the accreditation. That's something that Salisbury and Gemma have done really well, is to kind of recognise that we don't want to rush this. We want to use that accreditation to build knowledge and to make sure that the initiatives are kind of the right ones and they're having an impact, and that kind of travel and transport support in terms of developing your working group, getting other areas involved, that can take a little bit of time. And actually, there's almost as much value to that as there is to rushing through the accreditation. So, absolutely, when Gemma said, "Ask Tom," good question. I think we've worked quite closely together this last couple of years on Salisbury's journey, and I think it's great to see so many campaigns and initiatives and things being tried. And it is that next step of when you go from good to very good. It's about kind of now understanding the impact that those have had and collecting that data so that you can start to then showcase your modal shift or your behaviour change. So, yeah, in the case of Salisbury, once we've picked up that understanding of what has been achieved from all of those, it's very likely that you'll then progress higher on the accreditation. But, yeah, hopefully Gemma agrees that there's kind of a balance to be struck between progressing through the accreditation at speed and getting the recognition for that, but also going at a pace that you're learning and you're developing and you're maybe kind of streamlining your approach so you can really understand which initiatives are having an impact. Let's do more of those. Which initiatives maybe are not being received quite so well, and we wouldn't necessarily drop those, but we can kind of understand that maybe those are kind of moving to the background a little bit. So, yeah, next step is definitely moving forward in the accreditation. And yeah, and the last thing on that probably to say as well, that we recognise any modal data, so workplace survey or annual modal travel stats data within a 12-month period. So the accreditation, you might be doing some really great stuff, but there is a requirement that data and that analysis from all of that stuff is within a certain window as well. So you might do some of those campaigns and initiatives and then choose to survey at the end so you properly, and that might mean that your accreditation then moves up in a certain timeline as well. So yeah, hopefully it gives you a bit of background as to why there's been so much done, but we've not quite achieved that next level of accreditation, which is likely to come in the near future.
Have we got any more questions, Sarah?
Questions for Andy. Again, a question about the buses that you mentioned. Are these commercial bus routes or county subsidised routes? And also a question about people are really interested, Andy, to hear about your cycling figures. We do appreciate, obviously, there are massive hills in Sheffield, which might affect cycling figures. So if you could highlight the bus information and also any cycling figures that you might have.
Yeah, so the bus routes were commercial routes that were generally making an additional stop on a route that was already there. So, and in some cases they were using supermarket car parks, so they've got an agreement with a supermarket that the staff could park there and then walk to the bus stop and get on the new stop that was, as I say, already on a commercial route. But the number of buses, there's a bus service that serves the both hospital sites, and the relationship between Stagecoach and East Yorkshire buses is really good. So they're able to have those conversations, and over the last few years, bus companies have been very keen to try and get the patronage back up to where it was pre-COVID. So there's been some, they've had the mindset of, yeah, let's give this a try and see what will stick. And yeah, in terms of the bike usage, I'm not in Sheffield, but it's called Castle Hill for a reason. So it's also on top of a hill. So there is when you talk to some staff around what could you cycle, they'll often mention the hill. So yeah, the percentages are similar. They're about 4% of staff are cycling at the moment to Castle Hill.
Thank you. There's been lots of discussion in the chat, Joe, with regards to your connections and how you have established those links. Do you want to just give a brief update on that, given some people might not be reading the chat?
Hi, yes, sorry, I've been busy tapping away there, haven't I? So I've I've seen one of my colleagues joining from the Teaching Hospital Sustainability Network. So I suppose the strengths that we have in the city, and I'm sure this is the case across the country, is that we have various structures where we get to meet and find out. And like I was saying in my talk about beg, borrowing and stealing ideas, which I can see people are doing now from all sorts of different sites. That's what the value of these meetings, isn't it? So in terms of the links, I've personally had links with the city's physical activity scheme, which is called Move More Sheffield, which is aligned with the council and the Advanced Wellness and Research Centre, which is part of Hallam Uni. So it's that whole systems approach. It always comes back to the same thing, doesn't it? That we need to find ways to work across the system so that we can support these initiatives. And also, I want to make the point that I think I made it several times about working at scale, but also looking at how we can also include the people that would be less likely to think of themselves as suitable for active commuting. Just recognising the sheer scale of people that are in the NHS workforce. And I'd say particularly people on low pay. A lot of the admin roles, the people working in sort of clean, like the cleaners, the people that keep our sites running, have a lot to gain from sort of initiatives where they're more able to access walking, able to access public transport, and I think cycles. E-cycles is definitely the way ahead for the hills. Yesterday, I hit 5,000 miles on my e-bike, which I'm very proud of, largely from commuting 5 miles across the city. It's very possible with a bit of battery, I'd say. So thank you very much, Gemma.
Andy, we've got a question with regards to your survey results and how you managed to get such high numbers in terms of responses to the surveys.
Yeah, so in the first year, there's quite a lot of skepticism about, will we get the participation levels to achieve some decent data? And anecdotally, NHS staff they've constantly been asked their opinion about things, and so they just kind of get, they just ignore them when they come in. And we did talk at length before we launched year one. So year one, we had just short of 1,300 respondents. Should we offer some incentive? Should we have prize draws? Should we give some Amazon vouchers? Should we do this? Should we do that? And in the end, we decided if we did offer some incentive, if you're going to offer an incentive, you're always going to have to offer an incentive. So if you don't offer the one the year after, people are going to go, where's the voucher? Where's the freebies? So we took the view of let's give it a go year one. And we kind of pitched it as, we just want to understand what your journey is to work. So tell us what it's like. And everybody's got a journey to work. Everybody's got a story to tell, whether you're walking half a mile or you've got an epic commute or you're using multimodal journeys. Everybody experiences it twice a day, and we'll have an opinion about it and we'll tell you about it. So we kind of pitched it in that kind of way. And we also made it really, really short. So we kind of just used the template that Modeshift, the dashboard, provides you with, and we added a couple of other questions, and always an open question. And the open question, what people like to have a bit of a moan about the bus or the bike lane or the something or other, but that's just part of consultation. I think we have to accept that that is going to happen, but we can also respond to those people, and we've got dialogues with the bus company so we can explain that maybe there's a driver shortage, or if there's sickness with drivers, then priorities go to school routes, and explain to them. So, and in terms of getting people to fill it in, we are really fortunate. There's the wellbeing centre on site is actually, or was, a third of the dining room, so it's next to the cafeteria, so it's got a great footfall. So first of all, I think our surveys are open for a month. We try to avoid holiday periods, and we basically peddle that survey for a month outside the cafeteria. So we'll have a presence. We have done this in the past, have a travel event, so we'll have some freebies, but nobody gets a freebie nobody gets a pen until they've done the survey. We put some QR codes in the dining room on the table so people could do it with their smartphones during their lunch break. And I think we also were looking at the response rate and kind of, right, we need more, so we go back out, and we wouldn't close it until we'd achieved the response rate. I think finally is just go out there and you need to hustle. You just need to say, have you done your survey? Have you filled in your survey? If then somebody says no, there's the iPad, just it'll take 2 minutes, do it now. And so it is a case of you kind of trying different strategies to try and get that response rate up. Yeah, that's how we get where we get the successful rates back, return rates.
Thank you, Andy. Much appreciated. Appreciate it. So very thorough. And Gemma, I've noticed you've popped your hand up, so we'll just close on this final point, if you would.
Oh, thank you. Yeah, I just saw in the chat that someone had said about we make the assumption that everyone can ride a bike. And I touched on this in my presentation with the sort of cardio fitness that we offer, but also something that I did miss, which was on my slide, was that we've teamed up with a local cycling opportunities group, and they now offer free buddy rides for our staff. So if we've got someone that wants to ride their bike but isn't confident on the road, perhaps doesn't know the safest and best way to commute from their home to the hospital, they can contact them and they can get a free buddy ride. So they literally come and meet you wherever you want to meet them, and they will show you the safest way and the best way to ride, or just simply ride alongside you to sort of build that confidence.
Indeed. Thank you, Gemma. That's much appreciated. We are going to bring this section to a close. I think we could actually spend the rest of the afternoon talking about this. Some absolutely incredible presentations. I know Nick and Tom opposite me have been making notes during those. They've got their own questions and own ideas. But thank you so much to all of our presenters there. And we'd be giving you a round of applause if we were in person. If anyone wants to do the emojis, please feel free. There we go. We'll give you one on there. Fantastic. Okay, so now we're going to share the slides with you, and we're going to take you on to Modeshift Stars Healthcare. So if we have the next slide, please. And Tom is going to be presenting this. Next slide again, and then we are all caught up. So over to you, Tom.
Perfect. Thanks, Adam. So, yeah, I guess this is really about how do we wrap all those great initiatives, all that hard work, everything that's gone on in those 3 examples, but much more going on across the country as well, in a framework. So for background, everybody who's used Modeshift Stars within a healthcare setting at the moment across the last 20 months or so, perhaps slightly before that, has been within Modeshift Stars Business, which is a travel plan accreditation. Much of it worked. But what we really want to do is make this sector specific, so that you're working within your own framework that's recognised by NHS England, and your ambitions, aims and targets are specific to the sector and the people you're serving. So here we go. We have Modeshift Stars Healthcare. So I'm going to run through some slides. Admittedly, Modeshift Stars Healthcare is very detailed, a lot to it, and we're not going to get through it in 6 slides. But hopefully this serves as a great introduction. And I'm sure there'll be a lot more discussions that are happening between myself and NHS Trust and the other people in Modeshift and everyone who's involved in it. So we're really excited that we're launching Modeshift Stars Healthcare as our 4th National Travel Plan Accreditation Scheme from today onwards. So in terms of an introduction, it does provide a healthcare program, travel plan accreditation program for primary and secondary healthcare settings. So you can differentiate between the 2. We don't want you to be classing yourselves as something you're not. So it works for both settings, and it gives you the opportunity to recognise the efforts that you're making to achieve sustainable and active travel outcomes in your setting. So much of what the 3 presenters have been showcasing, that's what we want to shout about. That's what we want to recognise. Yes, we want to provide you with a tool to develop a travel plan document, but a document, it's so much more than having that document. It's about showcasing your journey, garnering support through increasing your working group, and progressing against the levels, and being recognised for that. So it's been developed in consultation. We haven't rushed this. We didn't want to rush this. So for us, this was about recognising, let's learn about the sector. Let's get a lot of different kind of experiences from trusts, integrated care board systems, primary care networks, NHS England, Net Zero, Travel and Transport themselves. We've spoken to, we've held consultation, we've learned from an awful lot of things this last 20 months or so to provide this new travel plan accreditation scheme. We are going to wrap it up with resources, guides, online packages that are going to support you to progress against the levels, to get accredited, to be recognised. So you're not on your own with this. At Modeshift, we will be holding events much like this as well going forward to ensure that everybody works together and everybody makes sure that that framework is relevant, set at the right levels, and you can all progress against it. So yeah, in brief, it's a 5-step process. So much like if you've used any of the business scheme, it will look familiar. So right from approved up to outstanding. And it should be, we are looking to create, deliver and keep track of those travel plans. So everything is going to relate back to that travel plan. And if you were going to really look at what Modeshift Stars is, it is a tool for developing a travel plan. It provides a national standard for those travel plans. So what should we be aspiring to do at each level, and how does that compare against our peers across the country? It is nationally recognised. So we've had Paul on the call. So we've done a lot of work to make sure that everything is recognised by the relevant organisations and accrediting organisations across the country. I'm really, really conscious against the environmental sustainability angle of this and the journey towards net zero. So it does have a carbon commuting tool to track those scope 3 emissions as well within it. So I think we'll go to the next slide. Stages of development. So yeah, I've kind of already mentioned this wasn't something we wanted to rush. We've gone through sort of 2 direct phases in developing this new travel plan accreditation scheme that you will all sit within shortly. So consultation with healthcare professionals. We've considered other models. So both internally at Modeshift, we have an existing school travel plan accreditation scheme, a residential one, and a business one. We've taken what we've learned from those schemes, what works, what maybe doesn't work for this sector. We've tried to make sure that it's got familiarity, so everybody's comfortable going into this new scheme. But we've also looked at models that are out there that are being used by other organisations to make sure that this really stands up and it is industry leading. So, and we've aligned it with the framework from other, from key documents and something that Paul was kind of outlining earlier on. So we've made sure that, to sort of flip to the bottom of that slide, the key areas of that travel and transport strategy, net zero, that was launched in October 2023 by NHS England, is ingrained in the framework that we are now putting you into. So if you're working your way through STARS, if you're doing a great job of kind of really promoting the initiatives that you're doing and taking on board help and advice within the system, you will be working towards those ambitions and targets set out within that document as well. And there's 2 specifically that I would kind of draw your eyes to. They're on one of the early pages on that document, actually, if you were to go back to the net zero document as well. So, but particularly by 2026, really be achieving our sustainable travel strategies. And then also by 2033, those emissions, so cutting those emissions by 50%. So we've really ensured that the framework and the support that's on there is going to help you work towards those 2 in particular. And then, yeah, phase 2 really has been working with you guys. A lot of you on the call, some perhaps not, but really understanding actually if we had you within the Modeshift Stars business scheme, what worked for you, what would perhaps posed a barrier, what was a challenge, how can we amend that, how can we work within the framework still so that you're achieving the right things, but how can we make sure the scheme is workable for you, doesn't place barriers to stop you aligning, moving through the accreditations, and kind of striking that balance between what is the requirement of the sector, so what do you need to do as organisations moving forward, but also what is the customer expectation. So yes, it needs to be challenging. Your targets and ambitions within the sector are challenging and ambitious, but we don't want barriers to progression through the accreditation either. We don't want you to get stuck and not have your work recognised. So we kind of believe that we've struck that balance between those 2 things. Next slide, please. Use of STARS business. So yeah, I mean, I could put an awful lot more on this slide, and I know I've spoken to many of you on the call across the last 20 months, but we've had use of the existing STARS business scheme by NHS England, the Net Zero team. So Paul, that's on the call, probably extend that to Andrew Bradley and Claire Phelan earlier on in the process as well. So making sure that they understand what Modeshift Stars is, how it looks, and how we might need to amend it to be suitable for the sector going forward. 37 secondary care NHS Foundation Trust organisations. It might be a couple more, actually. I'm now doubting myself, but certainly a minimum of 37 have used the Modeshift Stars business scheme. I've got an awareness of how it works. I've moved through the accreditation levels, and we've heard 3 great examples of people who've been involved in doing that. So we've picked up that knowledge and we've used that to produce this new sector-specific accreditation scheme. And yeah, also really conscious that there's a primary care journey in this area as well, and it's not secondary or primary, it's the 2 that we want to provide a scheme to suit. So 13 primary care sites, 2 or 3 primary care network groups have used this Modeshift Stars across the last kind of probably 12 to 13 months for the primary care network groups. Next slide, please. So we have a sort of clear pathway in place to help support you through the kind of accreditation progress. So I won't read all that out, but I think it's fair to say, we have support around getting started. So that is defining your travel plan objectives. So creating a travel plan in the very first place, making sure it's site specific, making sure it aligns into your aims and objectives. Assessing the situation. So can you look at the infrastructure across your site? Can you look at the policies and procedures you've got in place at the moment and assess that? And can we look at a baseline? So can you collect that baseline that Andy did such a good job of kind of telling us about how they go about that over in the East Riding of Yorkshire? Target setting. So there's no point in having these travel plans unless we've got targets. What do we want to achieve? Where do we want to go with this? And also that action plan. So I think going back to Gemma in particular, somebody mentioned how have they not achieved further than a bronze or a good site. It's not always about kind of rushing that accreditation. It's about saying, here's our action plan. Let's give that a shot for 12 months. And then let's look at using the Modeshift Star system. What's worked, what maybe haven't, how can we tweak it? And then build real behaviour change off the back of that. So yes, that will kind of lead on to getting a higher accreditation, but we can't forget that we do want behaviour change underlying within this as well. And so we don't want action plans that just carry on year. We want action plans that are kind of decided off live data, off analysis, off understanding what a head count or outcomes might be. So it's really key, that one. And then the final one there, obviously getting accredited at various different levels. And accreditation is really, I think it's really important to stress that the accreditation is something you can use to start garnering support, to start developing your working group. So it becomes more than that travel plan coordinator or that sustainability manager, and you've got more people involved. And sometimes having something tangible in your hands, like a certificate, like being able to go and say, we've got a good level travel plan, can just be that motivating factor to drag people in that are going to support you on this journey. So, yeah, and then ultimately on the right there, or left of the screen, sorry, is looking at, can we continue to monitor this? These travel plans, this framework allows it to be live. It should never be a document that's sat on the shelf. It should always be something that's continually looked at, continually live. And that's something that this pathway is going to kind of allow and support you to do. Next slide, please. So obviously this is sector specific. So I'm going to cover this very quickly, but anybody wants more guidance on it, I'm sure we can deliver it to you after this event. There are 9 specific initiatives. So we have a library of travel initiatives within our schemes, which are all great ideas. And the 3 people on the presentation have gone through many of them about how you start to generate support. How do you start to engage employees in sustainable and active travel? There's 9 NHS specific ones that are part of this scheme. And there's a requirement that you deliver 3 of these specific 9 to move across the framework, move across the accreditation. So just be careful when you're looking around the healthcare scheme that you do recognise the differences between Modeshift Stars Business and Modeshift Stars Healthcare. And hopefully Paul will agree, these have been developed and written into the framework with the support of NHS England. So these are things that are widely accepted within NHS England, should be put in place to support active and sustainable travel. And you can see there that we require 3 NHS specific ones, and then 5 travel and 3 supporting initiatives from our wider kind of evidence base of travel planning nationally at the first level of sign off. Just a quick one, if you've got an existing travel plan accreditation with us, once you move over to the healthcare scheme, you won't lose that level of accreditation, but you will need to deliver or ensure that you evidence that you've done the 3 NHS initiatives across the next 12 months to hold that level of accreditation. So no one's going backwards. You have a window of opportunity to deliver what you might need to do. Next slide, please. Some other key kind of changes really are building on that collaborative approach. So ensuring that you're evidencing within the Modeshift Stars healthcare scheme that you are working with local authorities, that you understand what the local transport authority officer name might be, if there is an opportunity to link in with funding. These might be areas that you're not aware of just yet, but it's something that we can obviously support within Modeshift, and other organisations, much like on this call, can support you to understand how do you start that journey with collaborating with local authorities, with other areas, with your local kind of community, to ensure that what you're doing with travel and transport isn't just sat within your organisation, but others are aware of it. But also that any opportunities you've got to gain support from others on, you are evidencing. And next slide, please. Here we go. Yeah, survey, monitoring, evaluation. So there is a minimum response rate. You can see them there. I'm not going to run through them, but it's based around over or under 100 staff. Response rates are always are topical. They're difficult. Everybody's survey, whether it's healthcare setting, higher education, business, schools, it's a challenge to get response rates. We've looked at the national averages when we've set these response rates, so we believe these are challenging but fair. We always look continually at responses that are coming in from surveys, so they can be amended if they are not fair. But yeah, these are based on national averages for healthcare settings as well to achieve these. Really, this is about as well providing you with useful data. So if you're going to go and develop a strategy for the next 5 to 10 months to reach net zero, or to get more people on bikes, or to bring down your single car occupancy, we want to make sure you're using data that is relevant and ensures that anything that you do put in place has a good chance of succeeding. So that's why we have a response rate. We don't want you to be making kind of costly mistakes or developing strategies based on a response rate that is really not showcasing the overall opinion across that site. So that's why they are there. Next slide. We have tweaked it a little bit, and this is a really good example of kind of how we've learned working with the trust and primary care sites across the last 20 months or so. We recognise that they're challenging, and actually there's different ways you can get your modal data. So the key question for us accrediting against things is, how do people come to your site? And we want to understand that annually so that you're working with data that is up to date, or as up to date as it possibly can be. And that means that those strategies you're developing off the back of that have a good chance of succeeding. But you might be able to get it from a workplace travel survey, so something that's wider, maybe 30 questions long, talks about barriers, looks at what policies and procedures people are using. It might come from an annual MUD of travel stat. So it could be as simple as you get out some comms and you ask people the one direct question of how do you travel to site. For us, we don't mind too much from an accreditation if it's one or the other. We want to allow that flexibility. From your point of view and from a best practice travel point of view, what we don't want to see is that workplace travel survey dropping out in terms of importance. But we can allow some flexibility. So there's two or three different ways. One good example of the annual mode of travel stats could come from a count. A traffic count perhaps, or it could come from that one key question, maybe when someone is checking in at reception. Andy pulled out a couple of good ideas in terms of maybe, I don't know if it's Andy or Gemma, sorry, but pairing it with an app. So a benefits app or a reward app, maybe you answer that question, you get 10 points towards that coffee, whatever it might be. So there's some creative ways, and we have some good case studies with Modeshift to share if you're struggling around kind of getting those response rates up. Next question. Next slide, please. I think it's the last one, to be fair. So Scope 3 emissions is obviously key in this area. We have a carbon analysis tool built into the system. It's really user-friendly and relatively easy to use. It works off the DEFRA conversion factors. So it's the most recognised tool for converting those CO2 outcomes. And it will work for up to 4 modes of travel and transport. So if somebody's performing that park and ride, or maybe using two or three different modes to get into work, we can still pull that data through. It's not linked yet to any accreditation level, and there's no plans to do that. It's simply there for a tool so you can start to understand what your carbon emissions are, either that's individual sites, a trust, or a primary care network as a total. But it's in there, it's free for you to use, and it should provide that environmental sustainability angle to things as well. Next slide, please. And like I say, one big thing for us at Modeshift is making sure that you're recognised for what you're doing, and a big part of that is the accreditation and the ability to move through it. But also, we have our National Sustainable Travel Awards. We are launching a new, a bit of a whoop from the back there.
Probably didn't hear that.
Yeah. I don't know if you all heard that, but I'm getting whooped at. We have a new national award, which is built around this healthcare sector. So, Healthcare Engagement Project of the Year. You haven't got long to nominate. So, nominations close on Friday, the 19th of July. Finalists will be announced on Wednesday, the 11th of September. And you can even see Andy there on the screen with some colleagues looking really chuffed about things last year. So, please do get involved in this. If you've got any kind of existing projects that you think might qualify for this, we will be awarding this in our awards and national convention in Leeds in November the 19th and 20th. So please, we will share more information on that, but please have a think and get involved in that if you can do. And I'm going to pass to Nick now, and once we've been through this next section, we will have some questions. So thanks, guys.
All I'm going to say is, before we move on, Nick, your power pose. Look at that left hand, eh? Absolute power stance.
Never know. Even sat here, I don't know what to do with my hands.
Fair enough.
Do you put them behind you? Do you put them in front?
Yep, you went for the thigh, forward-leaning thigh lean power pose. So thank you.
It's not a requirement that you have to stand like a boy band if you do win.
Tom, thank you for that presentation. We're going to hand straight into Nick now for the memberships and fees information. Please fire away.
Cool. So just if we jump straight to the next slide, please. I'll be super quick on this so we can get on to questions, because I've seen there's been loads more questions coming in, but we need to cover the important question of how much does it cost. There's some stuff on screen there, but just to talk through it, there are essentially 3 levels of access into Modeshift Stars. The first one is just purely site level. So you might be there, you might be at a GP surgery or a hospital on the call that just wants one site on the system. The good news is, if your local authority already takes part in Modeshift Stars and has a license, then there is absolutely zero cost to your site joining the scheme. You approach your local authority, you ask to be added to the Modeshift Star scheme, they can add you, and that's you away. It's super basic level access, it's basic site level access, but there's no cost, no barriers to you getting on that entry level. Second option is, if your local authority is not on the scheme, then we do need to charge an admin fee that gets you on, and it covers the future costs of accreditations. That's £150 one-off setup fee to get you set up there. Second level is that you might want to take a standalone Stars healthcare license. So that is an annual fee, currently set at £749 per year. But that will give you administrative level access to Stars. It will give you all of the reporting functions. It will give you the survey functions that Tom's talked about. And it will include one free place at our Stars in-person conference that takes place annually. And next year it's the 27th of March in London at the Royal Society. I'm now getting waved at behind the camera because I'm stealing content from the final slides. But that license fee includes that conference place as well. Or you might want to go all out. You might want to go for the top level package. That is the Stars license fee plus Modeshift membership. That is $948 a year, which that includes a £300 discount on your Stars healthcare license then. And not only does it include everything previous, the 10 sites, the Stars conference, but for public sector members, it includes a 2-day place at our annual convention and awards that Thomas mentioned. And as your public sector, because we know there's difficulties going to conferences and paying for accommodation, that does actually include your hotel and overnight accommodation for the evening awards as well. So there you go. So it goes from free for if your local authority is already taking part, $150 for the site, $749 if you want standalone Stars healthcare license, or $948 for everything, including events and hotel rooms and the lot. I think we'll go questions.
Yeah. So do we have any questions over in the question corner? If you do have a question, please submit it. Have we got any at the moment?
I have some questions. The first question I've got here, am I right in saying, Tom, that you've been sat in a dark room transitioning the NHS sites from the business Stars onto the healthcare? Is that right?
You are? I thought you were going to reference me trying to grow a beard for a minute there, but slight relief. Yeah, so everybody, you will find you've either been migrated over to the healthcare system, possibly in the last couple of days. If you've not been yet, you will be migrated over in the next couple of days. So we're in the process really certainly by the middle of next week. Anybody in terms of a login, an individual, or any site or healthcare trust, primary care network who existed within Modeshift Star's business will be in Modeshift Star's healthcare within the next few days. So do have a look around. If you've got any issues or problems with that, obviously get in touch with us. It should all work absolutely fine in terms of logging in. But if you do have a problem with logging in, please just get in touch with us. It's something we can fix relatively easy. But yeah, you will all find that certainly those of you who've got experience of using it, if you click on what was the business accreditation tab, it will now be the healthcare accreditation tab, and you'll see the new framework within there that you've been judged against. So you are right. I have a couple of days left locked in that room, and everybody will be within the new travel plan accreditation scheme.
Excellent. Thank you. We're grateful for you to be locked in that dark room. A couple of questions actually about multi-site trusts and how the system works for that. So for a multi-site trust, do the healthcare specific travel initiatives apply per site or for the organisation as a whole? And there's a question as well about travel surveys needing to be undertaken on each trust site. And do they require the minimum response rate, or is the minimum response rate for the whole organisation? Big questions again.
Big question.
Good luck.
We answer that. And do you want to have a go at it?
Yeah, I'll do part one.
You do part one, I'll do part two. You go for it.
So in terms of initiatives, well, I guess to step back a little bit, the STARS accreditation is generally awarded and generally intended to be applied at a site level. So an individual site within a trust. If you go for one of the STARS healthcare licenses, then you have a tool that tracks all of that and tracks all of the initiatives that have been delivered right across the trust in one place. But generally, we're looking at it, as I say, to be applied at an individual site level. That said, we, as part of these developments, one of the big feedbacks is I don't want to log in and enter the same initiative that is trust-wide 10, 15, 100 times, or in the case of Next PLC, who use STARS Business, 523 times, something like that.
559, I think.
Yeah. So what we've done is we've built a new function into STARS Healthcare that if you are working across multiple sites within the trust, you can enter that initiative once and it will be applied to all of the sites in one go.
Yeah.
Surveys?
Surveys, yeah. So surveys, like, really depends how you set it up in the first place. If you're setting it up as an individual site, like Nick's just described, really for your own reporting ideas and for your strategies going forward, you need to do surveys for the individual sites. So you're understanding what the behaviour change might be or what the current model use is at those individual sites. But if you set things up framework-wise, it's really about matching a survey to how you set things up. Are you doing a trust-wide travel plan, or are you doing individual site travel plans? You can, though, do your surveys, but you can still use one survey, but one of your key questions needs to be, which site are you predominantly based at? As long as you ask that question, which site are you predominantly based at, you could do a trust-wide survey. So, you're cutting down the potential of having 8, 9, 10 different individual surveys. You're doing that trust-wide survey, which might be easier, but you can define the answers, define the data for each individual site, and then you can put that headcount data in for each individual site. So, yeah, surveys, it can be more complicated than you think, really. It is about having that one key question in to ensure that you can split the data down and then add the headcount data in. Probably another thing on that is if you do have a car park that's shared by sites, make sure that you're defining the people that are parked in that car park, using that car park, which site are they then going on to travel to? Because you'll need to define your survey results for not the car park, but the site. Hopefully that makes sense. But there's a lot of support around surveys. There's crib sheets up on the system for you to really look into, or you can reach out to ourselves at Modeshift and we can give you some guidance around that. There's also a template survey built within Healthcare Stars, which is the NHS England recognised survey. So if you're after a survey that you want to use that's kind of recognised by NHS England and you can be confident in that, there is a template within the system that you can kind of plug and play with as well. So yeah, probably.
Yeah, I think that's the key point. Obviously, you're trying to apply it to a lot of sites.
Yeah.
So you're trying to make it fit multiple sites. So equally, I know that you guys are always open to questions if someone goes, what's in there doesn't quite fulfill what we need. So just get in touch with the team. Sarah, do we have any more? We could take one more.
Yeah, I think we've got one more. There seems to be comments about inclusion of other sites, care homes, GP practices, etc. So the cost per site for accreditation seems reasonable for trusts, but what about GP practices and ICB sites, which are significantly smaller in scale? I guess it's that inclusion of everyone involved in healthcare and how that fits into the pricing and participation in the scheme.
Yeah, it's quite complex to try and come up with a single pricing model that works for everyone. What I would say is if certain organizations are facing barriers to inclusion based on costs, is come and have a chat to us. And Team Modeshift is all about us all working together and finding solutions and working as a team. It may be that a primary care network wants to join, but is facing barriers to costs, but their local authority might already be engaged with us. We've got 111 local authorities that are part of our network that might already be part of STARS. Or we might have the trust that primary care network sits under. So let's have a chat and see if we can find a way, if costs are prohibitive, to bring you in so we can all work together.
Thank you for those questions, people that have submitted them. If we could share the slides again, please, that would be great. Tell me when you've done it, because I've currently took them off so we didn't have an infinity scroll. But we're now going to hand over to Sarah in the corner, who is Sarah in the corner. I need a better in question corner.
No one put Sarah in the corner.
No one put, well, we did. So Sarah is going to take us through the upcoming events. So over to you, Sarah.
Cool. Next slide, please, Tracy. Thank you very much. So coming up, we've got lots of events coming up. We have some training. So we have our Modeshift training plan coming up. We've got effective travel plans, which is taking place on Thursday, the 26th of September, down in London, followed by our other course, creating and implementing an effective travel plan program. Again, same place, Hamilton House down in London, and that's on Thursday, the 3rd of October. These are open to everybody. So if you are interested, please do take a look at our website and you can find the information there and yeah, come along. Next slide, please, Tracy. We have our massively awesome National Modeshift Convention. I would say that because I organised it. So yeah, it's going to be fantastic. So that's taking place on the 19th and 20th of November in Leeds. The theme is making sustainable travel journeys easier. And yeah, you can come and book your place now. It's going to be absolutely brilliant. We might even have a sword fight happening. If you want to see that, you'll have to come along. Yeah, book your place. At the evening on Tuesday the 19th, we also have our Team Modeshift National Sustainable Travel Awards. I know that's been mentioned already, but we have a number of new categories, which we encourage you to submit nominations for. The deadline for submissions is the 19th of July, which is next Friday, so you haven't got long to get those in. And obviously, we've heard some really great presentations today, and I expect those who have presented to put a nomination form in. We have, as Tom's already mentioned, some new categories. We've got Healthcare Engagement Project of the Year, which is specifically designed just for you to put your nominations forward. But we have other ones that you might be interested in too, Team of the Year, and we've also got Rising Star of the Year, Rising Star Award, sorry, for those who are doing some fantastic work. Next slide, please, Tracy. We also have our STARS conference taking place in London on Thursday, the 27th of March. That's happening at the Royal Society, which is really, really close to Buckingham Palace. So it's a really good venue. And again, booking for that's going to be open soon. So please do put that in your calendar to come along. One other thing that I've not mentioned, which I don't think we've got a slide for, are our other team talks. So we do have a number of other team talks planned. We've got an International Water School Month team talk taking place on the 1st of October, and bookings for that will be live soon as well. So basically, we've got loads of stuff going on. Keep an eye out for information coming forward, and make sure that you're booked on so you don't miss out. I think that might be the last slide, Tracy.
Yep, that is the last slide. We've got one more on here. It's just a thank you slide. So I'm going to leave this on our screen at the moment. But just a big thank you to everyone that's attended. But before we go, a couple of last quick fire questions to Nick and Tom here. What is the biggest two themes, one each, biggest takeaway theme that you think you've seen in our presenters today? Obviously, achieving great success in what they've done, real impact, which is absolutely outstanding. What do you think the biggest themes are that they've had going through their presentations?
Go on, I'll go first, and then it leaves you thinking. Yeah, I mean, the presentations were great, and so the questions were as well. The biggest thing for me that came through the presentations, and also I think comes through the use of stars and travel plans in general, is collaboration, and the key to achieving collaboration. So we see so many travel plans at the kind of birth, at the onset, of being that one person in sustainability, as the travel plan coordinator role, whatever it might be. And they're working to try and eke out those travel plan champions, and people try and generate some forward movement. And it is hard, like travel planning, behaviour change, achieving some real meaningful outcomes can be hard. But yeah, those presentations were great in really highlighting how you start that journey, you bring more people in to work alongside you, you work with every local authority, local community, local providers to start really trialing these initiatives and campaigns and seeing what works and giving it a shot. And that all comes from that one key individual really being able to collaborate with others and build that team and build that influence. And something Nick likes, which I totally agree with, is that sphere of influence. So making sure you're not working alone, but what you're doing is dragging other people in and making that case for, let's do more of this, let's get some more infrastructure, let's give people the opportunity to trial these things, because that's what's going to ultimately bring behaviour change. So yeah, presentations were great in doing lots, but definitely really showcasing collaborative working.
Yeah, and what do you think in terms of themes that you've seen today, Nick?
So I'm sort of being drawn towards like the creativity that's been shown, the innovation and keeping things fun. A lot of the times when we're doing sustainable active travel promotion, we're talking about the whys and sort of reducing carbon emissions, boosting the economy, increasing physical activity, things like that. Hardly anyone talked about that today, which is great. And I'm encouraging more and more people to focus on the real key benefits, focus on the fun stuff. That sustainable active travel can be fun. And the amazing thing about Team Modeshift and the stuff that we're all doing is changing all the time. Yeah. I've never seen a lock bar before. In 23 years of sustainable active travel, that's the first time I've seen a lock bar. There's always new stuff being presented to us. It doesn't have to be that, on the opposite of what Tom's saying, can be hard, but it doesn't have to be that difficult, some of the stuff. Sticking a lock bar on is such an innovative idea to stop you having to carry a heavy lock in your back if you are going to cycle to work. Equally, surveys, we hear loads of times how difficult it is to get surveys. And Castle Hill are sticking QR codes on the door while you're waiting to get your lunch. So just some nice, simple, common sense stuff. Creativity, innovative, lost it, and fun. So go with innovation fun. Finish on fun. Yeah.
I think, like you said, in essence, some simple ideas can really, like a QR code. And then it's like, where can we put this? And then you find out it works. It's good to practice and trial things. I think what I'm hearing there is about adapting, for the reasons why people may take up a sustainable mode of transport or change their travel behaviour from single occupancy car use. It'll be very tailored towards them, which when you're delivering at scale can be quite hard, because obviously everyone's got their own different reasons. But like you've touched on there, it's about getting that right, isn't it? In terms of getting the right reason for the right people to do the right activities. And making sure that they've got a wealth of choice available in terms of how they do it. And that might be in the form of education, in terms of going, did you know this is available? The e-bike as an example, with the hills. Suddenly they're gliding up the hills and they've done that. And I know the other challenges come about. We saw in the questions about how do you charge your EV bikes and all that sort of stuff. But obviously they're challenges that are healthy and you can sort of overcome, and hopefully more people. That's a good challenge to have to solve, because it means people are doing it. What would you say in terms of, the elephant in the room always comes back to funding? what do you think some of the challenges are in terms of overcoming those funding barriers that people are seeing? If we start with yourself, Nick.
Yeah, it's always going to be a barrier is funding these activities. We're in such an amazing place with sustainable and active travel that it hits on so many key policy areas. There's so many levers that we can pull on. And I mentioned them on the answer to the last question as well. As Modeshift, we keep having to change our hats. One day we might be an active travel professional. One day we might be a road safety professional. One day we might be engineering. One day we might be climate scientists. Anything like active sustainable travel can impact so many of those areas, and it's about us changing our message according to the person that we're trying to influence and get to join our team. So yeah, we just need to pull on those different levers. At the moment, we're looking at all the latest government policies that are coming out that are looking at environment, sustainability, and new house building. All of it impacts on sustainable and active travel. So yeah, just look at those different levers to pull on them, and the person that is the funder, try find which one of them it is that motivates them. We come back to sort of more simpler things. Sustainable active travel, it can save you money, it can improve your health, it can improve the air that you breathe, and back to the first question, it's fun. It's more fun than being stuck in a traffic jam. So pull on one of those 4 levers and the funder might just agree with you eventually.
Give you a helping hand.
Yeah.
Absolutely. What do you think about challenges in terms of, I mean, he's kind of touched there on collaboration, hence Team Modeshift. I mean, that's what it's all about, right? But that's not just working with Modeshift, it's about working with everybody in the sustainable transport sphere. How can you help people out? Do you have any advice in terms of overcoming funding issues or challenges, or looking at ways you could do it?
Yeah, I guess mine's a little bit more pragmatic. I don't know. So it's the STAR system. It gives you a really good area to gather that data, to gather that evidence, and quite often funding can be related to, well, show us the business case. If there's funding available in a local authority, if there's funding from a combined authority, perhaps to take part in a trial, what they're probably going to be interested in is what might the outcome be. So it's really easy within healthcare to kind of provide that particularly secondary care, to say, look how many employees we've got. So this is a potential pool that could benefit from this scheme, from this funding pot. But actually, STARS also allows you to break that down into, well, here's a recent survey that said 3-4% of people might travel by bike or could come by the bus, but this might be the barrier. So being able to present those cases, if there is funding, to try and unlock that funding is something STARS is quite good at doing. So yeah, sometimes it's frustrating to collect that data, to put it on and showcase it, but the more information you've got to provide is always a business case to unlocking any potential funding as well. So it's really kind of more of a pragmatic approach, I suppose, in terms of data can unlock some funding.
Yeah, so presenting the data basically to the funders and going, here, look what we can do. And I know that STARS obviously formed originally in the schools, then STARS Business. There's loads of data that you've shared in the STARS reports, where it's showing that modal shift and showing that impact. So I suppose you can cite that data, obviously, alongside the Active Travel England data and any other data that's out there. You can cite that and use that in your funding applications and things like that. Perfect. Okay, so I've deliberately left the slide. You won't be able to see it so well on the screen, but I've deliberately left the slide of the Modeshift convention on here. Oh no, that's the STARS conference. I was one ahead of myself. There we go. But the Modeshift convention. Nick, what's your favourite thing about the Modeshift convention before we finish?
Favourite thing?
Yeah, one favourite thing. We're finished on a light
karaoke.
No.
It's just the opportunity. We talk about how great Team Modeshift is and the different people and experts that it brings together. But it really is that opportunity to get us all together in one room at the same place. And we have members going away saying they feel reinvigorated and ready, sort of a restart of the year. To go away enthused and ready to put their plans in place to kick on. Then it sort of happens mid-November, so you can get your plans in place to really kick on in the new year. But that real opportunity to get together, collaborate and re-energize each other and sort of, get each other ready to go and tackle it again.
Yeah, what do you think, Tom? What's your favourite thing about the Modeshift convention?
Yeah, not dissimilar, actually. I mean, this team talk online is a really good example. I've been working with a lot of people that's on this call across the last 20 months or so. But the weather world works these days and things, particularly post-COVID, the opportunity to all to get together in one central place and share these ideas, bounce off ideas, some of the conversations that might actually just be over lunch, never always over a particular presentation, are so valuable. And it can be difficult to bring together everybody on that kind of large scale these days. So this is a one big opportunity to get us all in one place and really go away with new ideas, bit of confidence in what we're all delivering, and kind of give the next 12 months a good shot. So yeah, as much as it's been a really good event, good fun, really sociable, really kind of easy to kind of get your ideas across, just being able to take away those kind of guidance and a bit of confidence to keep us going is good. But yeah, so echoing similar feelings. Really.
Absolutely. So I think for me, having experienced the Modeshift convention myself, like I say, people in the industry are working in all different environments in terms of workforce, colleagues, different size. Some might be on their own, some might be in a team. What it does is it brings all those people together. So if you're working solo on active and sustainable travel, you've actually then suddenly got a bunch of colleagues on tap available at the convention. It is a fantastic event, and please forgive me for the sales pitch, but they wouldn't forgive me if I didn't bring it up. And it is truly a fantastic event, and even then it's not that much of a sales pitch because you can access it if you're a member of Modeshift. So if you want more information on the Modeshift convention, please go and check out the events page on the Modeshift website. And other than that, we will now be bringing the team talk to a close. Big thank you to all the presenters. Big thank you to Sarah in the Q&A corner. Camera on Sarah to give everyone a wave. Oh, bow. There we go. And obviously back to me, Tom and Nick. Huge thank you from us. And of course, Tracy and Sam behind the cameras, who've also been working on the slides, who have done a fantastic job. So other than that, we will be muting our microphones and cutting away, and we hope you've enjoyed the seminar. All the slides will be made available, and the recording will be going out there through the various channels. Thank you once again. We look forward to seeing you in the next event.